My name is Halyna Kornienko. I am the advocacy manager at Hope and Trust in Ukraine. We provide legal support to mothers on opioid substitution therapy and conduct research on women's access to sexual and reproductive health services. We are also one of the co-founders of the Ukrainian network of women who use drugs and proud partner of PITCH, the partnership to inspire, transform, and connect the HIV response. Globally, women make up a third of people who use drugs and one-fifth of people who inject drugs. Yet, 25 years since the landmark Beijing Platform of Action, the health and rights of women who use drugs are still largely unaddressed in drug policies at the national and global level. Drug use often contradicts the gender roles that society attributes to women as mothers, as partners, and as caretakers. This is especially true in Ukraine, where patriarchal values and religious institutions still hold sway. As a result, women who use drugs face intense stigma and discrimination and high level of gender-based and other forms of violence. They are also often unable to access family planning and other essential sexual and reproductive health services. Globally, 63% of women who use drugs do not use contraceptive, and many experience high level of unsafe abortion. Women also struggle to access appropriate ante- and postnatal care, as well as HIV testing, antiretroviral treatment, and services that prevent vertical HIV transmission. And when they have children, they are at high risk of losing them because our family court declared that the parental rights can be terminated if the parents are chronic alcoholic or drug addicts. In Ukraine, harm reduction and family planning services that are tailored to the needs of women who use drugs are almost non-existent. Research conducted by my organization shows that 50% of women were unaware of harm reduction services available to them during pregnancy, and 30% had undergone termination in the belief that it would be impossible to them to give birth to a healthy child. Gender-based violence is another significant barrier. Globally, 1 in 3 women will experience violence during her lifetime, but for women who use drugs, this number is often much higher. Without access to safety, healthcare, and legal support, women often remain trapped in a cycle of violence, and the impact on their health and that of their children can be devastation. This constant threat of violence also makes it harder to women to negotiate safer sex or to refuse to share injecting equipment, further increasing the risk of acquiring HIV and other sexually transmitted infection or blood-borne viruses. The arrival of COVID-19 magnifies the challenge ever further. Recent research by UNFPA predict an additional 15 million cases of gender-based violence and 7 million more unintended pregnancies for every 3 months the COVID-19 lockdown continues. In Ukraine, we are already concerned that women are facing increased level of intimate partner violence. At the same time, the sudden closure of harm reduction services and increases to police power makes it harder for women to access to opioid substitution therapy, needle and syringe programs, and other life-saving interventions. If we are serious about gender equality, we need to commit to equality for the most marginalized women, including women who use drugs too. This means ending AIDS among women who use drugs, stopping violence and discrimination against them, and protecting their safety and their human rights. Whilst events like this are start, bringing the impact of punitive drug policies on women's rights and health to the attention of decision makers, we need to do more. This includes increasing financial investment in community-led harm reduction and violence prevention programs that are led by women and tailored to women's needs, advocating for the decriminalization of drug use and sex work, and ending discriminatory laws and policies that prevent women who use drugs from reporting violence, accessing services, and exercising their parental rights. Unless we address this difficult subject, we will never realize the unfinished promise of the Beijing Declaration and Platform of Action. Achieving this vision within the context of COVID-19 will be even more challenging. That's why Hope and Trust, alongside 175 civil society organizations, have signed onto the Frontline AIDS call to action. This call to action asks governments and donors to sustain their investment in HIV and TB during the COVID-19 pandemic. It calls on them to provide community organizations with the resources they need to adapt their programs to meet this new challenge and to protect and hold the human rights of marginalized people, including women who use drugs. Thank you.